I work at the University of Minnesota Breast Center as a breast specialist. One of the questions that often comes to me is that women ask me, what can I do to reduce my risk for breast cancer or prevent breast cancer? And I usually look at it in kind of a twofold approach. First of all, I like to assess whether or not an individual or a woman is at high risk for breast cancer. And if she is, then it's important that she decide what kind of screening she needs to do, and that may be more aggressive screening and earlier screening than a woman who has a normal risk for breast cancer. If you do have a strong family history of breast or ovarian cancer in your family, we would want to make a referral to a genetic counselor. And that's something that we have very available here at the Breast Center. Then I talk to women always about lifestyle modifications and what they can do in their lives to reduce their risk for breast cancer. And some of the things that one can do is really engage in activity, and that means finding an exercise program that's really going to work for you, that you can use throughout the continuum of your life, so that when you're 60 and 70 years old, you still remain very physically active. Some of the things you might want to look at is, am I eating a plant-based diet that's high in plant protein like beans and seeds and soy and nuts? And then also, you really need a generous amount of vegetables. And that's something that we often forget. So the more vegetables that you can put on your plate, probably the better it is for your health. And in addition, adding fruit and berries are also very important. We'd like to encourage you to eat a lower fat diet. And when I say lower fat, I mean getting rid of some of the fats that maybe aren't as good for you, the saturated fats, and increasing some of those fats that are more helpful, like your omega-3 fatty acids that we find in fish. We also look at developing really good sleep patterns. Why is that so important? Well, sleeping at night increases the amount of melatonin, and there's some evidence that having adequate levels of melatonin in your body actually is or cancer preventative. So a good night's sleep, not only does it help for that melatonin and a healthy night's sleep, but it also is a vehicle for you to help reduce some of the stress in your life. And coming up with a good strategy for reducing stress is critical. So, and if that means engaging in some kind of meditation, prayer, qigong, tai chi, whatever kind of practice you might want to use in order to reduce that stress response. Lastly, I want to just mention that in addition to many of these lifestyle modifications, the most important thing, or probably the key to, is early breast cancer diagnosis. So we want to make sure that women are aware that they should be talking to their primary care doctor, get screening at appropriate times, so that we can diagnose a breast cancer at its earliest stage.